Hi everyone, I'm Faison Ofizi, a qualified personal trainer, and today I am with...
Hi everyone, it's Dr. G here today. I'm a full-time cosmetic doctor as well as an A&E doctor, and it's a great pleasure to be here with you guys today just to answer some very common questions about the weight loss in this industry.
Perfect. Alright, we're going to get into the questions. I'm going to ask him some questions about the Mounjaro and Ozempics, which you've all heard of, and you will learn about basically what they are. Alright, starting off with the first question, what is the main difference between Mounjaro and Ozempics?
So there's a lot of weight loss medication out there. Ozempic has been around for quite a long time. Now there are some newer drugs like Mounjaro, Wegovy. Ozempic is essentially a GLP-1 receptor agonist, and essentially it works by regulating the blood sugar levels, and subsequently it will reduce your appetite. Mounjaro is a more newer medication which does exactly the same thing, but it works at additional receptors like the GIP receptor, and therefore you can effectively say it's stronger or got double the action than Ozempic. So Mounjaro is now becoming increasingly popular, and there have been some recent studies that have shown the superiority of Mounjaro over Ozempic, but it's continuous, it's quite often that we do hear these names repeatedly in the industry. It's always either Ozempic or Mounjaro.
Okay, perfect. And what would you say the side effects of each of the drugs are?
So the side effects are quite similar amongst these weight loss medication. Some of the more common side effects are things like feeling nauseous, vomiting, constipation, diarrhea, and this can even lead to dehydration and headaches. Some of the more severe complications, although they are not that common, can involve certain organs such as the pancreas, the thyroid, and even the gallbladder.
Interesting. Okay, question number 3. Would you say they are safe for people who are not diabetic?
Yes, they are definitely safe for those who are not diabetic. However, I can't stress enough that it's very important to have medical supervision on board. So please just don't go out and just buy this medication over the counter or wherever possible. Please always seek for medical attention first. We've heard of Ozempic, which we've briefly talked about. We've heard of Mounjaro, but there's another medication called Wegovy, which is also semaglutide, and that is licensed for weight loss in those that are not diabetic. However, it's important to understand that there's not been any long-term studies on patients that are not diabetic who are using such weight loss medication.
Perfect. Okay, question number 4. Would people gain weight after they stop taking the medication?
That's a very good question, very common question, and unfortunately the answer is yes. So as soon as you stop the medication, there's most likely going to be some form of rebound weight gain. This is why it's very important to, 1, taper off the medication, and 2, also training your mindset and having the willpower to sustain a healthy lifestyle.
Alright, you heard it here. After you stop taking the medication, I think it's important to also adopt to a healthy lifestyle, following a healthy diet and good training. That will help you as well, obviously, especially after you stop taking the medication. Alright, question number 5. When taking the medication, how high is the risk of losing muscle?
It's very difficult for me to quantify how high the risk is in terms of numbers, but I think what we need to understand is the bigger picture here. For muscle loss or muscle atrophy, as you know, there's 2 key concepts that we need to be aware of. The first is resistant training, and the second is having adequate protein in your diet. So once you come off these medication, if you ensure a healthy lifestyle with a healthy diet, a moderate to high protein diet, and includes some form of resistant training in this, then you are going to minimize the risk of any muscle atrophy or muscle loss.
Perfect. Alright, question number 6. What advice would you give to people before taking the medication?
A couple of main things really, just to simplify the answer. The first is always seek medical advice before starting such medication. And by doing so, we will be able to sieve out any potential risks that you may have underlying for example, pre-existing medical conditions like pancreatitis, underactive thyroid, gallbladder problems. So I think it's very important to seek for medical advice before starting this medication. And the other thing, which is often overlooked, is having clear goals. It's a very easy thing to say, but I think it's important to have a clear goal of what you would like to achieve, how much weight you would like to lose. Is it sustainable? Do you have enough willpower and mindset to do so? How long do you want to be on the medication for? What's your goals in 4 weeks' time, 6 weeks, 3 months, 6 months, and so forth? So I think it's very important to set out goals for yourself and work in a multidisciplinary approach with a dietitian, a nutritionist, a personal trainer, your doctor, and take it from there.
All right, and now for the final question. How could people safely come off the medication?
For them to come off safely, again, as I previously said, you should be doing this in conjunction with medical supervision. So do please work with your doctor. And I think the other thing is to keep in mind is to try and taper off the medication. So try and have a more of a reducing dose before completely coming off and going teetotal. That way you can potentially avoid the risk of excessive rebound weight gain. So taper off, keep in touch with your medical supervisor, and keep yourself safe.
Perfect. Well, everyone, you've heard it here first. This is the effect of the Mounjaro on Ozempics. Of course, after hearing this, you know now how to take the medication, what it does, and how to safely come off the medication. If you need any more assistance or any more help or anything else you want to know, DM me on Instagram at PhysiFitnessPT. I've been Fizzy, and this has been Dr. G, and I will see you all again in another video.